Dr. Alasdair Baverstock is from Honduras. Her country is in the middle of a third wave of COVID-19 infection, and despite being on the front lines of the pandemic, she still hasn't been vaccinated. That's why she's currently in Texas. 2 hours after passing immigration at Dallas-Fort Worth, she's getting the COVID vaccine her own country couldn't give her.
Me preocupé mucho porque mi país para ese entonces estaba bien difícil lo que era vacunarse. Hay muchos casos allá también. La verdad sí, por la variante Delta que está saliendo, entonces ha habido muchos nuevos casos. La verdad significa mucho desde el punto de vista que se ha dado esta oportunidad de poder venir aquí, poder adquirir la vacuna, elegir todavía la opción de la vacuna, ya que en nuestro país no tenemos esa oportunidad.
Indeed, on the day she got her jab, Honduras had vaccinated less than 0.5% of its population.
Terrible. Hay muchos casos allá también. La verdad sí, por la variante Delta que está saliendo, entonces ha habido muchos nuevos casos. Así es muy bajo, porque incluso que son familias completas que se adquieren la enfermedad del COVID.
Dr. Baverstock is what's now known as a vaccine tourist, and she's not alone. Indeed, since the start of 2021, millions of people have flown to the United States to be vaccinated. America's surplus of vaccines has been in stark contrast to the deficit Latin America has faced. By mid-2021, the US had vaccinated 64% of its population, Mexico less than a sixth of its total, just 10% of Argentines, and in Honduras not even 0.5%. It's no coincidence, therefore, that Latin America, with less than 10% of the world's population, has accounted for more than 30% of global COVID-19 deaths. In February, Mexico, as a rotating member of the UN Security Council, spoke on behalf of the entire region.
According to data of the executive director of the WHO, and these figures are alarming, 3/4 of the initial 128 million doses in the world are concentrated in 10 countries, and those 10 countries represent 60% of global GDP. What we are seeing today is a huge gap opening up between the small group of countries that I mentioned and the majority of the international community. In fact, I don't think we've ever seen such a huge division affecting so many in such a short space of time.
And as less economically powerful governments struggled to attain vaccines, many citizens in Latin America have taken matters into their own hands, flying to where the vaccines are available, the United States. Jessica Gomez from Mexico City didn't wait around for her country's government to get around to her over 30s age group.
Decidimos que nos queríamos vacunar, que era una vacuna segura. Y bueno, como todo el tema relacionado con la pandemia ha estado muy mal manejado en el país. Y sé que como este evento masivo hay en todo Estados Unidos, ¿no? O sea, uno ve 1,5 millones de personas vacunadas al día y aquí no han podido ni... O sea, tenemos amigos doctores que recibieron la primera dosis y cuando les tocaba la segunda les dijeron, qué pena, no hay. Entonces, ni siquiera ellos que están ahí intubando gente los pueden proteger.
President Biden's pledge was to vaccinate all comers, regardless of nationality or immigration status. The administration actively wanted to vaccinate, and people were given shots with a simple ID, whether US or foreign. Tourists benefited from that flexibility. Indeed, many US regions used their vaccines to restart their tourism sectors. New York City offered week-long subway passes to those who received a vaccine. Colorado, $1 million lottery sweepstake. In Milwaukee, free beer. In Dallas, Texas, where free theme park passes were on offer, pharmacist Dr. Pamela Ingram has seen her fair share of vaccine tourists.
Yes, I have people from Bolivia, I have people from Argentina, I have people from Peru, come over, yeah, to Colombia. So I had one couple come over from Colombia, and they were only going to stay here for 21 days. So they came in, they had their bags with them, and they pulled up with their bags. I just got off the plane, come here to get my vaccine. We're staying, and they gave me the address of the hotel that they're staying at because we have to get their address to put on file. And we'll be here for 3 weeks, and we'll come back on our 3 weeks, and then we're going to head back.
Yet despite the US surplus of vaccines, they stay within US borders. The Biden administration eventually joined Russia and China in a pledge to share more than 80 million doses, 75% of them through the WHO's COVAX program, with Latin America as a priority. But the social divide remains. Those who can afford to come to the US to get their own vaccines.
Afortunada, porque la realidad es que no todo el mundo puede hacer esto, o sea, es más, la mayoría de mi país no lo va a poder hacer así, va a tener que esperar a que le toque y pues quién sabe cuándo sea eso.
However, at the western end of the frontier, a local initiative saw San Diego vaccinating neighboring Tijuana 2 months before federal authorities donated anything. In a neutral zone at the San Isidro border, the first ever international vaccine sharing initiative saw Mexican factory workers receive US vaccines.
No virus, especially one as infectious as COVID-19, respects boundaries. And we've been putting in so much effort in vaccinating to try and control the pandemic. UC San Diego Health recognizes we're part of a binational community. And to fight the virus and to end the pandemic, we have to work together across borders to fight COVID-19 in our area.
It was a project founded and led by the Mexico Consul General in San Diego, Carlos Gonzalez.
Well, this has been a local initiative from a group of actors who saw the opportunity to do their share in trying to take advantage of the relative oversupply of vaccines north of the border and the clear deficit of vaccines that exist in Baja, in Mexico.
The consulate's idea was to encourage vaccine sharing by having the US offer jabs to factory workers making products for the US export market. And while it was a grassroots project, it required authorization from higher up the chain of command.
It's a local initiative, but obviously we needed the support and the okay from both the federal government, US immigration authorities are federal, as well as the state. Because the county is not using their own, their reserve of vaccines. They are using a special quota of vaccines that they receive from the state specifically for this purpose.
The program aimed to vaccinate 10,000 people, and having surpassed that mark, continues to set an example for vaccine cooperation.
And the same cocktail of actors that made it possible here, you could find them throughout the border. In San Diego, as in the case of California in general, people understand very well the concept of equity in terms of access to vaccines, about making sure that people could have access to vaccines regardless of their migratory status or nationality.
While they may understand in California, elsewhere things aren't as simple. Indeed, America's undocumented migrant community has been one of the hardest hit by the pandemic. In Texas, while the Hispanic ethnic group makes up around 40% of the population, they accounted for nearly 60% of COVID-19 deaths in 2020. In Dallas, Mari Gomez lives in a Hispanic majority neighborhood devastated by the virus.
Mi abuelita acaba de morir de COVID y mi tío murieron de COVID. Pero sí he escuchado muchos amigos que se han muerto de eso.
Indeed, Dr. Ingram has witnessed firsthand the economic struggles the Hispanic community has gone through.
They don't want to be sick. They don't want to take off from work. So they go to work sick, and then they kind of spread it around that way. Like people go to work with a cough. They think it's just a cough or just a cold or gripa. They don't think it's COVID. They don't like to think it's COVID. So they go to work, Or they come here and say, hey, what can I take? Because I have to go to work tomorrow. What can I take to get rid of the fever, the chills, the aches, so I can go to work the next day? You know.
But it's not only economic concerns. False information about vaccines circulating in the community has done a great deal of damage.
Primero que nada es por mucha desinformación en las redes sociales, que la vacuna te hacía daño, que esto y que el otro, entonces mucha gente decidió no vacunarse.
Despite seeing numerous deaths among her family and friends firsthand, Mari believes what she reads on Facebook.
No, todavía no me he vacunado.
¿Y por qué?
Pues te digo, me da miedo qué es lo que me vayan a poner y pues he escuchado como que tiene como side effects, que les dice, oh, me están insertando un chip o que me vaya, que hay mucha gente que está muriendo porque le están poniendo la vacuna. Y pues le da mucho miedo, que dice, no, pues, ¿qué me van a meter o qué me están metiendo acá?
Yet, getting the community vaccinated, especially undocumented migrants, to achieve levels of herd immunity is vital. Shanti Shahani is the founder of a volunteer group named Vaccine Finders, who have worked tirelessly and free of charge in the Dallas area to secure appointments for whoever might want them. The volunteer group began through sourcing vaccines for friends and family, yet finding appointments for Dallas's undocumented community became an obsession.
You know, we all know people that are undocumented in this country. Pretty much everybody knows someone, especially in Texas. There's a lot. We found that there's this big barrier with undocumented migrants who were afraid. They're still afraid of getting a vaccine because, you know, they know that if I go and get this vaccine, I'm going to be entered into this registry. Hey, if I go and get the shot, is someone going to be waiting outside my house or my kid's school to take me away?
It's estimated more than 500,000 undocumented migrants live in her city, and Shanti quickly worked out where and where not to send them for their shots.
And of course, we had a lot of people super grateful that because they wanted the vaccine, so they were telling us quite a lot about it. So we would get a feel of the best places to send people, really, and that's all we did. It was really, there's no system to it. It was just, hey, knowing that guy over there on that pharmacy, maybe we don't send people there, because there were some pharmacies that literally turned people away.
Today, Shanti and her fellow volunteers have sourced vaccines for more than 4,000 people.
It's kind of like those little silver linings that COVID left. We found a group of people that believes like us that if we do something for one other person, that we could improve the way that everybody lives.
And despite her tireless work, she says they are set to benefit.
We wanted people to understand that we think that this is in our benefit as well. Well, ultimately, we all want to get back to normal. So we have to do our part and get vaccinated for our own good and for our community.
For Dr. Guevara, being able to return to work on the front lines of Latin America's ongoing pandemic, she feels a sense of relief.
Pues la verdad me ayudó muchísimo, ya que con la dosis de la vacuna que voy a recibir, pues voy a estar protegida para poder atender a lo que son las personas, porque no es tan fácil. En mi país hay un brote ahorita de casos increíblemente numerosos y pues la verdad yo estoy muy agradecida porque Estados Unidos está brindando esa oportunidad para lo que es el turista de poder adquirir su vacuna.
She returns to Honduras better protected from a virus that has ravaged Latin America. Life may be returning to normal in Texas, but as the third wave rears its ugly head in Latin America, the region is currently facing its highest spread of infection yet. And as it does so, it will be vaccinations, administered either by local governments or the US to its vaccine tourists, that may shine a light at the end of the tunnel.